All right, thanks, Chris. It's an exam that puts many women may put off because of fear and what they might find. But tonight, in light of Breast Cancer Awareness Month, the Now's Tori Cooper is addressing those fears by talking to breast cancer professionals and one survivor to learn more about the benefits that come with early detection and the options women have here in Kern County. Tori?
Jessica, the National Cancer Institute and Adventist Health Bakersfield doctors both say 1 out of 8 women in the U.S. will develop breast cancer over the course of their lifetime. That's why this week professionals are spending time educating women in the community about their options in case it happens to them and how they can avoid breast cancer diagnosis. Adventist Health Bakersfield nurse and director of cancer services, Melina Thorpe, knows what it's like to tell women in Kern County they have breast cancer.
For any woman, when you get the diagnosis that you have breast cancer, it's pretty shocking.
But after spending over 2 decades supporting women through the life-changing diagnosis, she still never imagined the tables would turn the way they did in her own life.
In 2009, I was diagnosed with early-stage breast cancer from a routine mammogram.
Once the doctor, now the patient. After a routine breast cancer screening she says she always kept up on.
I was always very diligent in getting my mammograms, and I went that year and they found a very early stage 1 breast cancer.
Thorpe says many women are avoiding breast cancer screenings with this machine because it can be an uncomfortable and frightening process. But she hopes this October during Breast Cancer Awareness Month that more women choose to be brave because it may mean the difference between life and the alternative.
Usually women who don't go for mammograms or are afraid to go for mammograms, you know, we find them at a later stage and it's a lot harder to treat and to cure.
According to the California Cancer Registry, in 2014 there were more than 25,000 new cancer cases among women in California and more than 4,000 deaths associated with the disease. In Kern County alone, there were 444 new breast cancer cases. Data from the registry showed the most common cancer in California is breast cancer, and Thorpe says those findings are still consistent today in Kern County.
Breast cancer is the #1 cancer that we diagnose and treat at this facility.
If we look at the first picture on the right, it's level 1.
Today, breast surgeon Connie Lee showing women how breast surgery methods used to remove cancerous cells is continuing to become more advanced since the early days in the 60s.
And nowadays, we have things like this, what they consider scarless surgeries.
Dr. Lee says scarring from breast cancer surgery is very minimal now because doctors no longer have to make such large incisions. Even though you may see some scarring, the treatment process is not as radical as many believe.
But generally, it's just taking that area of your breast out.
Lee says she merges cosmetic surgery techniques when conducting cancer removal operations to help women feel more comfortable with the process. But Thorpe says each treatment option is different for every woman, including her.
I had a lumpectomy. My surgery was in October. I had 6 weeks I had some genetic testing. I had radiation for 6 weeks after the surgery, and followed by tamoxifen for 9 years.
Thorpe says even though she has remained on medication for the last 9 years to maintain her remission, she is thankful that she did not have to go through chemo because she was able to detect the disease early. And she hopes that by spreading awareness today and throughout October, others will take the same steps she did.
That's it. And I'm good.
So that they can stay breast cancer free too.
Now, in light of Breast Cancer Awareness Month, Adventist Health will also be offering free clinical breast exams in about 2 weeks from now on Wednesday, October 24th. There will also be a girls' night out event where survivors and community members will have access to cosmetology vendors, reduced 3D mammogram screenings, a fashion show, food, and more. For more details on both events, head to our website, turn23.com. For the Now Bakersfield, I'm Tori Cooper, 23 ABC. All right.